Hi guys, welcome to my video, A Day in the Life of a Paediatric Nurse, as requested by Thamina Begum. I hope you're saying your name right. Thank you so much for watching and subscribing. So my average day starts at 7:45 with a main handover in which the nurse in charge from the night shift is present and all the day staff. And she will just tell us the main issues that are going on in the ward and the social issues and the things that every member of staff there needs to know about. After that, we'll go to the patient's bedside and get an individual handover of each individual patient that will be in our allocated areas for that day from the shift before that's been looking after the patients overnight, and we'll get more an in-depth handover there about particular patients. We'll also decide, me and the nurse I'm working with that day, who will take which patients and allocate patients to ourselves. We can have a massive variety of patients that we're looking after that day. We might have a patient going for heart surgery and we need to do all their pre-op things. We might have a patient being discharged. We might have a post-operative patient that has drains, urinary catheters, IV heparin infusions, IV fluids, and pain management. And those type of patients sometimes need hourly checks of their drains, their catheters and things like that, so they can be quite heavy and quite a lot to look after in the day. After that, I'll go to the individual patient's notes and I'll have a look at the drug chart, the feeds, their OBS, the notes that were written by the night staff the shift before, their fluid balance and their weight, just so that I'm prepared for the ward round and that I know what my patient needs in that day. And then I'll go over to one of these forms here that I designed myself, and I'll write my patient's name that's at the top, and down the sides are all the times, and I'll put in things like their when they're due their medication, when they're due their feeds, when they're due their IVs, when they're due nebulizers and things like that, and also additional things that I need to do, such as if they need daily weights, daily ECGs, MPA, bloods, any particular test that I know that they need that day, and I schedule them in so that I can fit it all in. Around between 8 and 8:30 I'll go and see my patient, and I'll see them in order of who I think needs to be seen first in terms of their clinical what's wrong with them and who's the sickest. I'll do all their observations, listen to their chest, check their oxygen and suction, and ask them if they've got any questions. You can tell a great deal from doing this initial assessment. It's a really important part of a nurse's day. At around 10 AM the doctors come round for their ward round, and they will assess the patient also and ask them questions. They might order tests like ECGs, echoes, x-rays, bloods. They might want certain procedures done like drain removal. They might change the medications or remove some medications and add some medications. You as a nurse need to really be prepared to know what's going on with your patients in terms of their fluid balance, their weights, their drug charts, what you need to know from the doctors, what you need the doctors to do for you and for your patient, their OBS, their drain losses. These are all the things that the doctors will want to know about, and you as a nurse need to be prepared for them to ask questions about. So in the course of a day there might also be unexpected events. There may be emergency situations with the patients. The patients may get abnormal test results such as raised CRP or low hemoglobin or low blood sugars. They might become pyrexic. They might increase in their respiratory distress, become tachycardic. They might need cannulation or need blood tests. You might have a patient that bleeds in the day, and it can be something very big like a resuscitation situation, or something really small like a baby pulling out their NG tube that needs reinserted. That kind of just these little things that take up your time in the day. Through the day also I'm writing my notes and charting their observations, and the day ends usually at around 8:15 when I am handing over to the night staff about what has happened in the day, and then I go home.